it is present in your drug interaction. So metronidazole is important. Please learn it properly. Alright, both tissue and luminal amebicide, nitroimidazole, metronidazole, tinidazole, secnidazole, ornidazole, satrinidazole. So these are congener of the metronidazole. And alkaloid, amethine and dihydroamethine. So where have you studied this amethine? আর কোথায় পড়েছিস? So these are highly emetogenic drug. ঠিক আছে, বমি করানোর জন্য ইউজ করা হয়। পড়েছিস তো? আচ্ছা, extra-intestinal amebicides only. So example is chloroquine. আর কোথায় পড়েছিস chloroquine? হ্যাঁ, ম্যালেরিয়া। So this is another use of chloroquine. ওরালে যখন জিজ্ঞাসা করে ক্লোরোকুইনের ইউজ স্টপ বাই ম্যালেরিয়া। So there are plenty of other use of chloroquine. One of it is tissue amebicides. Alright. Then luminal amebicide that are active only in the gut. Active against amoeba only in the gut. Example, parmomycin একটা আছে, tetracycline একটা আছে, these are antibiotics. And deloxynate fluoride. Alright, and then there is 8-hydroxyquinoline. These are tissue amebicides. So there are some certain side effects of this 8-hydroxyquinoline we will discuss subsequently. So most important is the metronidazole. Alright. So let's study this mechanism of action. So metronidazole is converted into an active nitrate radical. Alright. So this nitrate radical is cytotoxic and it is also toxic against the amoebal bacteria. And it requires a microaerophilic condition. So this nitrate radical requires a microaerophilic condition. By microaerophilic condition, I mean, what do you mean by microaerophilic condition? So there is decreased oxygen supply. Alright. So in decreased oxygen supply, the anaerobic pathway of the bacteria gets activated. So in anaerobic pathway, the pyruvate is acted upon by this P4. Alright, pyruvate ferrotoxin oxidoreductase. Now this pathway is hampered by metronidazole. So metronidazole, this nitrate radical act as a acceptor of the electron. So synthesis of ATP is hampered. Do you get it? জয়িতা কি ভাবছে গালে হাত দিয়ে? No. So this is the active metabolite of metronidazole. So in the respiratory pathway, this pyruvate is releasing electron. So that electron is being taken up by this reactive nitrogen species, not synthesis of, it is not utilized in the synthesis of energy. So the amoeba become energy starved. ঘুম কেটেছে? পাচ্ছে না? ঠিক আছে, বুঝেছিস কি বললাম? বাহ। So toxic to anaerobic and microaerophilic organism. The reactive nitrate radical is required, microaerophilic conditions are required for production of this reactive nitrogen radical. Then after entering the cell, nitro group is reduced to highly reactive nitro radical, ঠিক আছে, act as a electron sink and accept the electron from the pyruvic acid, the pyruvate, then exert cytotoxic effect and damages the DNA. So which other organism may be affected by this metronidazole? আর কোন অর্গানিজম এফেক্ট করতে পারে মাইক্রোএরোফিলিক কন্ডিশনে? So the anaerobic bacteria, they are sensitive to this metronidazole. Alright, কে বুঝেছিস? ওই আসি বুঝেছিস? So aerobic environment attenuates cytotoxicity, ঠিক আছে, it requires anaerobic environment or microaerophilic environment for action. The same thing, there is diffusion of metronidazole, this active metabolite, then acts on DNA, also cytotoxicity. Acha. Some pharmacokinetic parameter, good oral absorption. So for tissue amebicides, for liver abscess, it can be used, or for any tissue infection, it can be used. Widely distributed, so it can be used for various other infection, ঠিক আছে, anaerobic infection, giardiasis, other infection, it is also effective. Then therapeutic concentration in vaginal secretion. So which infection it may be used for? আর কি হতে পারে ভ্যাজাইনাতে, কি হতে পারে? জিয়ার্ডিয়াসিস, হ্যাঁ, ট্রাইকোমোনাস ভ্যাজাইনালিস, ঠিক আছে। half life is 8 hours. Some side effect, first and foremost, it produces a metallic taste. If side effects are asked in the oral examination, do say the word metallic taste. Examiner loves to hear this adverse effect, ঠিক আছে, vomiting, nausea এগুলো বলে যায়, do say this word metallic taste, important adverse effect, and nausea, vomiting, all these things. Acha, prolonged use may lead to peripheral neuropathy. So where you must be careful about giving this metronidazole? Why should you be careful while using metronidazole? So if there is any neural problem in the patient, you must be careful giving metronidazole, ঠিক আছে। drug interaction with alcohol, এ কি করে করে? Anybody? Or go? How drug interaction take place with alcohol? Well, Vidipta bol. So it inhibits aldehyde dehydrogenase, ঠিক আছে, aldehyde dehydrogenase, alcohol dehydrogenase. So alcohol is converted to aldehyde, ঠিক আছে, so it is aldehyde dehydrogenase, ঠিক আছে, this aldehyde is converted to acetic acid, so aldehyde dehydrogenase converts to aldehyde to acetic acid, that is inhibited. So there is excess accumulation of acetaldehyde in the body, not alcohol dehydrogenase, বুঝলি, not alcohol dehydrogenase, aldehyde dehydrogenase, ও ঠিক বলেছে, ঠিক আছে। So there is accumulation of acetaldehyde in the body that will lead to severe adverse effect like vomiting, uneasiness, ঠিক আছে। So contraindication with neurological diseases, blood dyskaryosis. So there is no evidence of any teratogenic effect. There is not much of proof of its safety. Alright, it is better to be avoided, though no teratogenic effect has been demonstrated. Asha. So it's a drug of choice in amebiasis, both for tissue amebiasis as well as for luminal amebiasis. ঠিক আছে? So luminal amebiasis, liver abscess, not effective against cyst. So what can be the problem? কি হতে পারে? There will be communal spread. Within the community, the disease may spread. In case of asymptomatic cyst passer, it won't be much of use. ঠিক আছে? Medicine is also about prevention of disease. ঠিক আছে? So it won't prevent, it will cure the person, but it won't prevent the spread of amoeba. Other use, giardiasis, Trichomonas vaginalis, anaerobic bacteria. So name one anaerobic bacteria. What? Clostridium. ঠিক আছে? Pseudomembranous enterocoliticus কোন অর্গানিজম করে? How pseudomembranous enterocoliticus is produced? So these are produced by excessive use of antibiotics. The gut flora is being wiped out by excessive use of antibiotic. That leads to colonization by the pathogenic organism, mostly anaerobic bacteria. Amrita, ভেঙেছে? Acute necrotizing ulcerative gingivaginitis, all are caused by anaerobic organism. Then Helicobacter pylori causing কি কজ করে? আলসার, পেপটিক আলসার. Helicobacter pylori comes as a short note. ঠিক আছে? There are 3 or 4 regimes. So do learn any one of them properly so that you can write it out in your exam. খাতায় খুব খারাপ ভাবে লেখা থাকে Helicobacter pylori, প্রায় প্রত্যেকবারই আসে, এভরি অল্টারনেট ইয়ারেই আসে, খুব খারাপ ভাবে লেখা থাকে কিন্তু. So any one regime with drugs, the complete regime, all right, with name of the drugs, formulation, dose, how many times per day, and treatment duration. Can anyone say at least one regime? একটা regime যে কেউ? PPI পুরো ওরকম PPI বলবি না, সে প্যান্টোপ্রাজোল আর ওমেপ্রাজোল, বি স্পেসিফিক. কি কি দিচ্ছিস? ট্যাবলেট না সিরাপ? কি দিচ্ছিস? ট্যাবলেট. সো বি স্পেসিফিক. ট্যাবলেট প্যান্টোপ্রাজোল. তুই ডোজও বললি না, ডিউরেশনও বললি না, কিছুও বললি না, আমি তো সেটাই বললাম. ওরকম ভাবে বললে হবে না. প্যান্টোপ্রাজোল 40 mg BD, ঠিক আছে, for how many days? Amoxicillin for how many days? What is the dose? The complete answer must be present. খুব বাজেভাবে লেখা হয়. Helicobacter pylori, another indication of metronidazole. ঠিক আছে? ওরাল পরীক্ষার সময় জিজ্ঞাসা করে what are the uses of metronidazole? তো হা করে বসে থাকে, কেন জানি না. So at least you say amebiasis, and there are also other uses. ঠিক আছে? Try to mention at least Helicobacter pylori. Tinidazole. So tinidazole has a half life of 12 hours. তাহলে it can be used for single dose. তাহলে metronidazole কি ছিল? 400 mg TDS করে. ঠিক আছে? Tinidazole can be used for 2 gram OD once daily. ঠিক আছে? So that is the advantage of using tinidazole. দিনে একবার খেলেই হয়ে যাবে. Then suited for once daily dose. So less adverse effect. The metallic taste, it is less for tinidazole. Secnidazole even longer half life. ঠিক আছে, 2 gram single dose, only one dose. That is the advantage of secnidazole. ঠিক আছে, ornidazole, stanidazole, these are all congener. These are also have higher half life. The dosing required is less. By dosing I mean the number of time that has to be given. আচ্ছা, diloxanate furoate, ঠিক আছে, this is a luminal amebicide. So the advantage of diloxanate furoate is it acts on cyst producing trophozoite. ঠিক আছে, তাহলে কি হবে? So community infection can be stopped. Question comes, diloxanate furoate and is combined with metronidazole for treatment of amoeba. ঠিক আছে, so the answer will be, well, answer কি হবে? Amrita, why are they combined together? So diloxanate furoate will kill off the will stop passing out of cyst, prevent community infection, and metronidazole is a luminal amebicide, is both a luminal and tissue amebicide, it will kill the trophozoites. ঠিক আছে, so they are combined together. তাহলে highly effective luminal amebicide, no systemic antiamebic effect, kill trophozoite responsible for production of cyst, mild intestinal amebiasis, asymptomatic cyst passer, these are candidate for diloxanate furoate, especially for cyst passer they are used. Then adverse effect, flatulence, nausea, itching, combined with metronidazole. Metronidazole I mean also stanidazole, secnidazole, these are also combined with diloxanate furoate. ঠিক আছে, another is a niclosamide. Have parasitology হয়ে গেছে, বল niclosamide use কি পড়েছিস? So congener of niclosamide, it is also used in giardia, cryptosporiodosis, amebiasis, Trypanosoma vaginalis. So mechanism of action, inhibit P4. আচ্ছা, 8-hydroxyquinolines. What are 8-hydroxyquinolines? These are luminal amebicide. ঠিক আছে, these are also effective against the cyst, trophozoite producing cyst. তাহলে what do you notice out here? There are iodine molecules. ঠিক আছে, there are iodine molecules. So what may be the adverse effect? iodine molecule থাকলে কি হতে পারে? থাইরয়েড হয়ে গেছে তো। So what is iodism? Well, iodism কি? So there will be excess of iodine in the body that leads to a phenomenon known as iodism. শুনেছিস কোনোদিন? শুনেছিস? Have you heard of this term? No. ঠিক আছে। So hydroquinol and quinodoclor. So these hydroxyquinolones have has been banned in certain countries for some adverse effect. Let's see. So it is effective against Entamoeba, giardia, Trichonosoma, Candida. So kills cyst forming trophozoites. So these are also effective against cyst passer. No tissue amebicidal action. useful against chronic intestinal amebiasis, iodism or prolonged use. There is excess of iodine. কি সেটা তো বলতে পারলি না। So now this is the adverse effect for which it has been banned, subacute myelooptic neuropathy. So in Japan it was found that this compound produces subacute myelooptic neuropathy. So in Japan it has been banned, though in India it is still available. Enteroquinol, নাম শুনেছিস? Enteroquinol, sold as brand name. So paramycin. So this is a এই gentamicin হয়ে গেছে তো gentamicin. So this is a gentamicin antibiotic. ঠিক আছে? So antibiotic gentamicin is effective against which bacteria? জোরে বল, gram negative bacteria. ঠিক আছে? Route of administration of gentamicin, route of administration. So gentamicin is used only in IV route. It is not absorbed in oral route. কেন? It remains in ionized form. It is only effective in IV route. But here it is given in oral formulation. তাহলে কি হবে? Any systemic effect? No. There will be no systemic effect. It will only pass through the gut without any metabolism, without any absorption. So what will be its effect? First and foremost, it will mechanism of action bolchi. So first and foremost, it will bind to the 30th ribosome of Entamoeba and inhibit protein synthesis. And secondly, it will kill off bacteria. Why are bacteria important? Why are gut bacteria important? Amebiasis কি করে? জোরে বল। আরে ভিটামিন ডি এখানের কথা বলছি। So amoeba requires this gut bacteria to survive. There is symbiotic relationship between amoeba and the gut bacteria. ঠিক আছে? So killing of bacteria destroys the support for amoeba. So that is an indirect effect. So there will be no systemic effect because there is no absorption, systemic absorption. Aminoglycoside এর কি systemic effect হয়? Systemic adverse effect of aminoglycoside. Yoida. Anything? So it's a nephrotoxic drug. It's an ototoxic drug. ঠিক আছে? টেট্রাসাইক্লিন কি? টেট্রাসাইক্লিন কি বল, জোরে বল। Which kills which bacteria? So broad spectrum antibiotic effective against both gram negative and gram positive. আর কি কি ইউজ আছে টেট্রাসাইক্লিনের? এটা একটা ইউজ against amoeba. It is used against luminal amoeba. ঠিক আছে? আর কি ইউজ আছে? ইনফেকশন রিকেটসিয়া। আর কলেরা তো সে ব্যাকটেরিয়া অ্যান্টিব্যাকটেরিয়াল অ্যাকশনই বলছিস, আর effective against ম্যালেরিয়া, I mean প্লাজমোডিয়াম, ঠিক আছে। Now mechanism of action, now for this, in this case, for amoeba, a large quantity of tetracycline are not absorbed from the gut and they go to the large intestine. So what will happen to the intestinal flora? কি হবে? So the intestinal flora are being destroyed by tetracycline. So the support required by the amoeba, that is lost. ঠিক আছে? So there is this is an indirect effect leading to the death of amoeba. ঠিক আছে? So inhibit bacterial flora symbiotic to amoeba. Chronic case used in chronic case with little mucosal invasion because it's a luminal amebicide, not a tissue amebicide. ঠিক আছে? Alkaloid amytine dihydroamytine used for vomiting. ঠিক আছে? It is not given orally. Either it is given IV, either it is given IM or by subcutaneous route. It is effective against amoeba, but it causes vomiting. Not given orally. ঠিক আছে? ক্লোরোকুইন আর কোথায় ইউজ হয়? Malaria. So question comes, what is the treatment of Plasmodium or Vivax malaria? So in that case you must write the dose and the complete regime. অনেকগুলো regime আছে দেখবি, there is chloroquine sensitive malaria regime, there is chloroquine resistant regime. So learning this regime properly, question comes for malaria, the treatment for Vivax malaria or falciparum malaria. Sometimes it is specified treatment for chloroquine resistant falciparum malaria. Alright, sometimes they give question like unconscious patient diagnosed with falciparum malaria. So there are regime for each of them. Learn this regime well. regime গুলো কিন্তু পরীক্ষায় আসে এবং কলেজের পরীক্ষায় যা আনসার দেখি খুব খারাপ লেখা থাকে। ঠিক আছে? If you expecting the marks by writing the same way, you are not going to get one. So if you want to get good marks, the name of the drug, dosage and duration, that must be present. Just chloroquine লিখে দিলে কোনো নম্বর পাওয়া যাবে না। ঠিক আছে? Write it properly. এইবারেও এসেছিল, এর কোশ্চেনটা কি এসেছিল, স্ট্যাটাস এপিলেপটিকাস, জাস্ট লিখে দিয়েছে লোরাজিপাম। খাতায় যা দেখলাম আমি তার কথা বলছি, জাস্ট লিখে রেখেছে লোরাজিপাম। ওরকম একটা লোরাজিপাম দিলে হবে না, ইউ মাস্ট রাইট দ্য ডোজ অফ লোরাজিপাম, how long it has to be given, that must be written. If it fails, what must be given, that must be written. In front there must be some general treatment. General treatment কি হবে? কি হবে general treatment? Status epilepticus এর in general treatment কি হবে? ABCD, airway, breathing, circulation, এগুলো লিখতে হবে। If you wish to get a proper, if you wish to get full marks, you must write this also. ঠিক আছে? একটা লেস লোরাজিপাম এরকম লিখে দিলে কিছু কিন্তু নম্বর আসবে না, খুব খারাপ ভাবে আনসার লেখা হচ্ছে। ঠিক আছে? ক্লোরোকুইন, it is used as tissue amebicide. এই ক্লোরোকুইন পড়ানো হয়ে গেছে, ক্লোরোকুইন পড়ানো হয়ে গেছে, ম্যালেরিয়া হয়ে গেছে। সো ক্লোরোকুইন ইন ওরাল, uses of chloroquine are asked, just malaria বললে কিন্তু হবে না। if you say malaria, say chloroquine sensitive falciform malaria, chloroquine sensitive 5x malaria, what other use, আর কি ইউজ হবে, এই একটা ইউজ, used against amoeba, আর কি ইউজ হবে, আর কি ইউজ হবে, এনিওয়ান? আচ্ছা পড়ানো হয়নি তো, ঠিক আছে, but you must know the uses of chloroquine. Chloroquine is an important drug, comes as a short note, comes as a long question, know it very well, ঠিক আছে। ইউজ, অ্যাডভার্স এফেক্ট সব কিন্তু ভালোভাবে যেন জানা থাকে ক্লোরোকুইনের, ঠিক আছে। সো অ্যাডভার্স এফেক্ট কি হয় ক্লোরোকুইনের? হ্যাঁ, শুনতে পাচ্ছি না। আচ্ছা, so he is stating about retinopathy. Retinopathy happens in chloroquine after prolonged use, ঠিক আছে। আর কি হয়, highly emetic drug, ঠিক আছে, causes vomiting, ঠিক আছে। So acute amoebic dysentery, so these are the severe form। তাহলে কি কি, oral metronidazole 800 mg thrice daily for 7 to 10 days, ঠিক আছে, alongside with diloxinate furet। কেন diloxinate furet কেন ইউজ করছি? So mild intestinal amebiasis 400 mg thrice daily for 5 days plus diloxinate furet, ঠিক আছে। liver abscess 800 mg thrice daily for 10 days, or it can also be given IV 500 mg 6 hourly for 10 days, ঠিক আছে, alongside with diloxinate furet, ঠিক আছে। So another the same thing what I have shown earlier, ঠিক আছে। That's all for today. Okay. One thing I want to stress that the answer sheet are not up to the mark. খুব খারাপ ভাবে লেখা হচ্ছে কিন্তু আনসার, যা খাতা দেখলাম খুব খারাপ ভাবে লেখা হয়েছে। প্লিজ ইমপ্রুভ অন ইয়ার আনসার শিট।